From accidents to degenerative diseases, bone trauma results in more than 2 million surgeries around the globe each year, and that number is increasing as our population ages. About 20% of bone trauma won't heal naturally. That means surgeons are carrying out bone grafts in an attempt to repair damaged bones. But it's a procedure that has a number of challenges.
Traditionally, there are two ways to use. One is to use synthetic bone substitute. As a man-made bone materials, they have issue of cause inflammatory reaction. The other way to do it is to use bone graft material coming from deceased donors, and often they have a risk of transmit disease and may cause infections.
But what if the future lay just below the surface of these pristine waters off the coast of Broome? A marine biomedical breakthrough with the power to heal bones. Professor Zeng and scientist and orthopaedic surgeon Dr. Ryan believe they've discovered a solution to this challenging situation for surgeons and patients alike.
Our journey began with the question of how can we heal the bone better in a natural way. And in this case, we actually learn from nature. Nature already told us the best way of mineralization in organism is actually 7 million years before human beings appear.
So when I start this research, I found a very interesting report that shows the whole scientific community actually been fascinated by archaeological finding from the ancient Mayan people. So in the 80s, a jar from ancient Mayan people actually been found in Honduras. And they found that jar actually have a teeth vertically placed. And they scan it through the X-ray, found it's actually a mother of pearl pieces. And that pieces fit and integrate into the jawbone perfectly.
Their research led them to Broome in search of the perfect raw material.
This is not just a beautiful pearl shell, it is a calcium carbonate crystal. And this calcium carbonate crystal, it is what nature has already perfected the process of mineralization in organism. They tell us how can we lay down the calcium. So we learn from nature to convert these calcium carbonate crystal structure into human bone matrix.
And once the pearl bone has been manufactured, it's been designed to be easily used by surgeons.
I was trained as an orthopedic surgeon basically in spine unit for 7 years before I joined the research team.
The Broome region hosts the best pearl shelf in the world, and we got the best resources to make pearl shelf into human bone.
Well, at the moment we utilise the pearl shell for making ornamental products, jewellery as well, but this has now developed a new opportunity for us to be able to utilise the shell for an innovative way that will benefit everyone.
Which is where the company this man, Paul Birch, is the CEO of, comes into play. Willie Creek Pearls, Western Australia's most awarded pearling operation, is pivoting after an unusual request from Marine Biomedicals. The company started to nurture the pearl bone journey.
There's a saying that Broome was built on buttons, and that's because originally the divers weren't after the oysters to grow pearls inside, they were actually after the oysters for the value of the shells themselves. With the invention of synthetic materials and plastics, the value of the industry declined significantly.
For several decades, the pearl shells have been a low-grade byproduct of Broome's pearling industry. But all that might be about to change.
Well, it's unique and it's probably the purest nacre that we can find in the world. Because we did a comparison study with the pearl shell we collected from other regions from the world, actually the pearl shell from Broome have the lowest level of the heavy metal contamination, which meet the criteria for using as a healthcare product.